All right. Welcome, everybody. Today, we are going to learn about a career as a family practitioner, and it's with Dr. Ian Horner at Greenfield Health. Before we start, as you know, make sure you check in. That's how your teacher knows that you are in this event. And if you have questions, this is a great questions document that you can reference to. And the evaluation form, that's the most important thing to do right after the event. Be fully present, pay attention. If you have questions, you can raise your hand and talk on the microphone or put it on the chat. And then the most important thing is your evaluation. Again, make sure to do it right after this event. It is your attendance, and this is how we track and give you credit. And this is a requirement for graduation in high school. And if the QR code doesn't work, we will put the bit.ly link and then actual link into our site so that you can do all of this on that. And you can turn on your camera so that Dr. Horner can see you. You are not going to show up on the recording, so it's safe to turn on your camera. I think that is it for me.
Well, very good. So I suppose that's my introduction. My name is Ian Horner, and I am a doctor. And more specifically, I'm a family medicine doctor. So most people in this Zoom have been to a doctor at some point in their lives. And you probably saw either a pediatrician or currently going to a family medicine doctor, and that's my role. So I was approached to talk with the students, you, about my educational journey that brought me to being a doctor. And I knew at a young age, probably around 9 to 10 years old, that I wanted to pursue being a doctor. Saw it on television. In fact, I used to watch, they had a show that had surgeries on it. And I used to watch general surgeries on public TV, basically. And I thought, man, that is really cool, and that's something that I want to do. And so from that point on, it started my trajectory towards medicine. So I grew up outside of Seattle and graduated from high school. After high school, I went and got a 4-year degree at a college in Seattle. And I studied and chose to study science, which is a common field of study prior to going into medical school. And so I chose a degree of biochemistry and completed that in 4 years. Now, I did not have success initially in getting into medical school right away. And so I had to work for 1 year before I got accepted the following year into medical school. And so I did 4 years of medical school in California in the Bay Area. And I graduated there, and upon graduation, I am declared a doctor, which is great. And in some places, I can go and practice general medicine, but after 4 years of medical school, it's most common to go on and do what's called specialty training. And I am a specialist in family medicine. And so what that means is that extra training is 3 years. And I did it in New York City. And I spent 3 years in a hospital there learning all about medicine and family medicine and what that looks like. And upon graduation, then I could go out into the world and help people as best I could. So I just my goal today was to talk through, undergraduate is 4 years, medical school is 4 years, and then I had 3 more years of specialty training. So after high school, I spent 11 more years of education in my training, which is a lot. But that was what's necessary to be a family medicine doctor. Now, there are other specialties and surgeons. I said I went to, when I was a young boy, I wanted to be a surgeon. That obviously changed. But I wanted to allow for some dialogue about, or questions about other parts of the healthcare industry, because being a doctor is one thing. There's nurses, there's medical assistants, there's phlebotomists, there's administrative assistants, there's administrators. And so there are a lot of different facets of the healthcare system that I would be willing to talk about as well. And so I thought of a couple questions that we might encounter. One, have I ever fainted? No, I have not fainted. I have a really strong stomach. I've seen some really weird stuff. And I have not passed out yet. Two, what is the coolest thing I've ever done in medicine? I went on a medical mission trip to the Amazon in South America, and I had to perform surgery, a major surgery, but I had to amputate a finger. And so I ended up amputating a finger. And that's the only time I've done that surgery ever. And that was probably the most interesting thing that's ever happened. What does a normal day look like for me? And I work in a clinic. The Greenfield Health is where I'm currently working. My role is not just as a clinician, but I'm also an administrator. I'm a medical director, which means I make sure the other doctors are doing well and patients are doing well and all the staff are here and we're able to help as many people as possible. But I have a pretty 9 to 5-ish job, an 8 to 5 job really. And I do take Wednesday afternoons after 1 o'clock to do things like this. So anybody at Liberty High School have any questions? Are there any questions? I'm watching the chat box. I have one question for the technology administrator. I'm getting a lot of pop-up alerts about admitting people into the room. Is that something that I need to do, or is that something that's handled?
I can go ahead and take care of that.
Okay.
So there's one question that I put in there. What are the most and least rewarding aspects of your job?
Ooh, my most rewarding aspect is just the opportunity to help people. I mean, it's very cheesy to say, but it feels nice when you have knowledge or skills to be able to share with people. And in medicine, they come in like, you know, there's not a more vulnerable place than we do when we come to the doctor. So I love helping people. My least rewarding part is dealing with insurance companies. That's a real pain in the butt. I see what made me decide to move to Oregon. Well, I grew up outside of Seattle. You heard I spent some time in California, in New York, and I actually lived in Chicago, and I wanted to come back to the Northwest, and I didn't want to go back to Seattle area. So I live in Beaverton and love it here. What skills are needed to be a doctor? Well, I mean, that's to be a family doctor, I think you need to be a really good listener. I think a good communicator is really important. Is it sometimes hard on your emotions? Yeah, absolutely. I mean, I laugh with my patients. I cry with my patients. I get really sad. You know, death is, I've had patients that die because they're older or sick. And there are some days when it is really emotional. Yeah. If there's no rain, then you can't appreciate the sunshine, I think is kind of part of the outlook there. What was the most difficult moment in your education? Ooh, that's a great question. Alan, good job. Well, I mean, 11 years of education after high school, that's a lot. I would say, you know, there were just moments that happened, and there are, when you're in medical school, you have to pass what are called medical boards. And those are probably the largest hurdle that existed in, you know, getting certified and becoming a doctor, those medical boards. If you could go back in time, would you choose the same career? Yes and no. Yes and no. Yes, because I love, there's, again, going back to the joys of sharing my skill and knowledge and helping people in really vulnerable situations is unmatched in what I'm doing. And I don't think that I could do that again. Is it really, really hard? I think that with mainly insurance stuff and the regulation stuff that's coming along with practicing medicine nowadays has made it really, really tough. And we've seen a lot of medical providers quit as a result. So I'm not unique in that part. What's the outlook for this career? Everybody gets sick, they're gonna need it. Is there an oversupply? No, there's a massive shortage of doctors. And so we're in very, very, very high demand. And Danielle, if I could choose, so do I. I'm sorry, Danielle, I can't, if I could choose, whoops. Okay, Ellen, what advice would you have for aspiring doctors? Stuff like college, things to focus on. You know, good grades is important, sciences are important, but that's not the end all be all. I think that the advice for aspiring doctors in middle school and high school, I think it's really important to start having some experience within the medical field. I had volunteered in high school to be a part of an EMS squad, and that's actually something you could get a summer job as a high school, is you could go through EMS, and those are the guys in the ambulances, and you can actually have a paid job in high school. But I did a volunteer of that, did in undergrad, again, my choice was science and biochemistry, but I know other classmates and other doctors that were philosophy majors and student athletes, and I think there's a lot of different things, a lot of different paths that could lead you to medical school and beyond. The biggest advice is just don't quit, because it's really hard. What is the most disgusting thing you've ever seen or heard in medicine? I mean, it depends on what you think is gross. I was just talking about how getting earwax out of people's ears is satisfying for me. It's weird. Dr. Pimple Popper, and you squeeze those zits and you get that stuff. Those smell really bad, by the way. But disgusting, I mean, that's all relative. When you see the inside of a belly, I mean, nothing's really disgusting any longer. Would I choose another specialty? What would it be? I really like sports and sports medicine. Maybe would consider going back and doing orthopedic surgery. Would be something that, if that were an opportunity, I might consider. What soft skills are important in my job? You know, one of the things that I think is really overlooked is writing. And I was a horrible English person in high school. Not horrible. It was not my strongest aspect. But certainly I do a whole lot more writing in my career than I thought that I would do. And that's certainly something, and communication skills are always huge. And so working on good, effective, closed loop communication is something we constantly coach on here at the clinic. What do family practitioners do exactly? So there's heart medicine, cardiology, there's lung medicine, pulmonology, there's sports medicine and orthopedics, that's your joints and bones. So there's always the different subspecialties in medicine. And in family medicine, we do all of it, just a little bit of everything, including pediatrics, including geriatrics. And so in family medicine, what does a family practitioner do? We do pretty much anything we feel comfortable doing, from delivering babies to taking care of old folks to minor surgeries to managing blood pressure. Yeah, it's really broad, and that's part of the reason I enjoy it. There's a saying, jack of all trades, but a master of none, and it means you get to do a lot of different things in a lot of different things, a lot of arenas, but you don't specialize just in one of them. Angelina said, are there opportunities for growth in this career? Yes, absolutely. And I'm an example of that. I think that there are practitioners, and like I had shared earlier, I'm the medical director, which is administrative. And so opportunities for growth in my career would be continuing to practice and take care of people, and or pursue higher administrative, maybe go and teach is one thing that I've thought about, going and teaching at med school or a PA school. So certainly have plenty of opportunities outside of clinical practice with my skill set and knowledge. How did you manage your studies in medical school? Marianne, that's a great question. You take care of business. I was a list person, and so I would make a list of all the things that I desired to do. I would prioritize them as most important to least important, and I would go until I couldn't. And what are important skills or personal qualities that are good for this job? Knowledge retention and application, communication. You'll hear me say communication a lot because I think that that is really important. But teaching, I think, is something that's important too. I try and teach my patients a lot about themselves. Those are just a few examples of skills. What's a typical day in your work life like? In the clinic, we'll use Monday. In the clinic at 8 o'clock in the morning, I start seeing patients right away. I will see patients until about 1 o'clock in the afternoon. I will have one 30-minute break during that time. And at 1 o'clock, then I will start doing some meetings and setting up educational, informational stuff for the clinic, working on contacting patients if they need to. And I'll do that until about 5 o'clock, perhaps later. And then I'll go home. What would I say that I genuinely enjoy your job most of all the time? Would you say that you genuinely enjoy your job most of all the time? Yeah, I would. That's a good question, I think. I was having a conversation with a colleague today. I'm the happiest in my current practice in what I'm doing, and I think I'm going to stop calling it a job and start calling it my I don't know, patient care, something different. It just doesn't feel too much like work. It feels like I have some purpose in what I get up and get to do. Are you still able to have a social life in medical school? Have time to yourself or to have fun? Not really. If I'm going to be really honest, not really. Not a lot of time. With the commitment that you're making from an educational standpoint, you really do have to learn a lot in a short period of time, and it takes a ton of dedication. And you get your weekends, and you get your weekends here or there, but it's certainly something you're dedicating yourself to. All right.
So I saw, or I heard actually, you say that EMS would be a good opportunity for high school students. Do you know of any like other opportunities like internships or side jobs that might be helpful for kids interested in that field?
Yeah. So I think ultimately when we're talking about medicine, you're talking about caring for other people. And so I think that any kind of service job, to be very honest, is really good preparation work. And it could be service like working at a restaurant to working at a nursing home, washing dishes, and any kind of service that's done helps create and cultivate kind of an idea or awareness of what part of helping people we enjoy doing. So I had my employment history actually kind of speaks to that. I had worked at a coffee shop when I was in high school. I also delivered papers back when they had papers. And I worked at Nordstrom selling shoes, which was also a really interesting career choice. And I worked at a golf course. So I definitely didn't, my employment didn't mimic kind of what I was doing in an academic volunteer type of realm. But I certainly think that the service industries really helped me understand how to communicate with people when they're upset, when they have questions, concerns, demands, and how to monitor those kinds of things. But EMS is good. I have coached, I'm the team doctor for the football team at Southridge. And I've had the honor of working with some students that are really interested in that realm. So most schools will have an athletic trainer who know a doctor or few. And so if there's some connection that can go on there and some mentoring through those kinds of things and opportunities. And so I know that I've done that for my students that I've come across. But EMS as a job is actually kind of a cool, career option, not something I was even really on my radar when I was in high school. But I found out later on that several people in medical school had been EMT, which is interesting. There was another couple of questions that rolled in. Would you recommend learning skills like CPR and first aid if you're interested? Yeah, I think that getting CPR certification is good for a lot of different reasons. I also think that as you're going through that little course, the CPR course training, it gives you an idea of like, oh yeah, this is really pretty interesting stuff. And if it kind of hits a certain level of interest, then medicine or working in the medical field may be right. A good work-life balance. So I think that that's an interesting question because I would say absolutely. I enjoy work and I enjoy life, and they both intermingle. So there are times when I am on call during the weeks or weekends, and so it means I have to maintain cell service and means saying no to certain things that are some social gatherings. But to me, that sacrifice is just part of being a doctor, and that is part of my life. But I certainly, work hard and play hard and enjoy the non-work based stuff. What time did I say go home on Mondays? 5-ish. Biggest challenge in my career right now is misinformation from COVID. Is the largest thing in primary care and family medicine in my specialty. We get a lot of questions about COVID, and that has been a large challenge right now. After my first surgery, how did I feel? Good. I mean, again, I didn't become a surgeon. You sit in as a part of your training. You work with surgeons and you sit in surgeries and you help with surgeries. But I've never really done what I would call a surgery in the formal operating room. Have you had a bizarre patient case every week? Every week. And are there things that you wish you knew before pursuing this profession? That's a great question too. Yeah, I think that I would go back and I would say this is going to be a really rewarding career and profession, but it's going to be with some sacrifices, and those sacrifices will come for chunks of time, specifically your medical education and medical school. You'll be pretty much absent for those 4 to 7 years.
And I was looking at your website a few weeks ago, and I saw that you guys have it's more a patient care focused. Do you want to go a little bit into that? Because I kind of got the sense it was different from a standard clinic.
Our clinic model is slightly different than a routine clinic in that we are what's called membership based. And so our patients pay a monthly, kind of like a gym membership, and it's age based. And so with that, we can see patients the same day or the next day. And that's really the difference of our clinic amongst some other nuances behind the scenes. But it's not much different than a primary care other than the membership based and the access to care is really our emphasis. We do have other specialties in our clinic. So we have 2 dietitians, we have licensed care social workers, we have a physical therapist, amongst different kinds of providers. So we have doctors, we have a naturopath, we have nurse practitioners, we have a PA. And these are all different specialties, but all an equal part of the team and what we're trying to accomplish here. So you don't have to just be a medical doctor to be in the healthcare system. If there are some other things, there are other opportunities, nursing, nurse practitioner, physician assistant, so all the like. And what will you do if you are not accepted? What will you do if you are not accepted? That was me, Goldie. I was not accepted to medical school 1 year, and I worked at a golf course, and I retook the test that you do to try and get back in, and I reapplied. And I've heard of people who have applied for several years and not had success, and then suddenly got in. One of my medical school friends was 54 when he started medical school. So he had started after a full career in the tech business. Out of curiosity, I know it's not your specialty, but can you tell me a bit about naturopathy? That's an interest of, okay, so yeah, mine, good catch. So naturopathy has a different educational background. It's more focused on looking at like herbs, spices, roots, and how those can affect your body and your biochemistry. And it's a similar type goal, is to try and help the body do well. And I can't speak much past that. Any other questions? This is great. I mentioned doing biochemistry in college. What is it like doing that major? It's really tough. It was a really tough major. Partly why I chose it. And I wanted to see if I could tolerate the more rigorous kind of academic course load. If I could go back, would I be a biochemistry major again? No way. I would have tried to walk on to the baseball team, and I would have been a science minor and maybe a psychology major or something like that, linguistics. I was also good at math, but I would have done something a little bit differently. My best strategy for retaining information, the rule of 3. You have to see something 3 times before you're more, and statistically speaking, more apt to remember it. And so try to see the information at least 3 times. And for me, it's learning about how I learn best. Am I a good listener? Do I need a visual cue? Do I need to write it down or feel it? And it depends on the topic and subject of what I'm learning, but try and always get the rule of 3s, see it at least 3 times. Much time between my undergrad bachelor's degree and starting medical school, 1 year. So I took one gap year, as it were. Heather's great question. Advice or resources that I can give to help students prepare for medical career. Guidance counselors are actually a very, very, very good resource. But again, I don't think they're the end all be all. I think the most important thing in understanding a career in medicine is that there are just lots of opportunities. If a family practitioner is what you desire to do, then I would express that to your family provider, family physician, and they can help provide you with personal contacts, because I think that's the best. And getting in, seeing what a clinic looks like, what the other side of it looks like, not being a patient, and seeing if that's truly something that you want to start doing and pursuing. There are lots of pre-medical resources available in the college setting. And it's a pretty common interest of people going in. And so but it is tough, and that's why there are not as many people who graduate with the pre-medical degrees when they go in. Average salary of a family practitioner, a full-time family medicine doctor in the Portland area, I think is about $225,000 a year. How long have I been a family practitioner? 8 years. The better question pointer is, how much did medical school cost? And medical school was about $75,000 a year times 4 years. Plus 7% interest that starts on day one. Debt did I have, including undergrad? Yeah. There may be scholarships available for medical school. There are certainly some programs that exist through like the military, that if you enlist in the military, they'll pay for medical school, but you owe some service. My overall debt, boy, that's a personal question. About $580,000 was the total debt coming when I started. Do I have any more of that student debt? Thankfully not. Was very judicious in money management. Are there any? Yeah.
Is there
Okay.
someone in your family is also in medical field, or are you the first one?
No, my mother was a registered nurse. So my mother was a labor and delivery nurse for 30 plus years. So I'm not the first person in medical. I was the first person to get a graduate degree in my family. So that was kind of cool.
Is that one of the factors that made you decide to become a doctor?
Oh, maybe. There's certainly no doubt that my mother had an influence on that, a very positive influence. She was the one that, told me that after I expressed that I wanted to go to medical school, that she said, well, you're going to have to get good grades. And I remember that very vividly. It was in the 8th grade, and from the 8th grade on, I got as best of grades as I absolutely could.
When you failed the medical school the first time, did you think of like, okay, this is not for me, I'm gonna move on to something else, or you were like, okay, I'm gonna try again? And
there was a lot of self-doubt. Absolutely. Am I going to make it? I didn't make it the first time around. Am I smart enough? Should I keep going? This is something that it was a goal of mine, and it was my first major obstacle in not getting accepted in my first round of applications. And it was really hard. It was really tough. Thankfully, I had a good support system around me with my parents and family and friends that knew my potential, encouraged me to keep pushing. And I just, kind of kept going for it. What advice would you have for me in the 9th grade about common pitfalls in high school? Boy, that's tough. Make sure you know who your friends are and that they're really good influences, right? If somebody doesn't make you feel good, they're probably not your friend. That's first and foremost. The second one is, everybody's path is really different, and respecting each other as we go along, and recognizing that your path might be a little different from somebody else is cool. And everybody's on their own journey. Do your best at whatever you choose, right? That's the advice that I would give. Do the best in whatever you choose. If you do that, you're going to have tremendous success.
have you ever had the feeling of being an imposter, and how did you overcome that feeling?
Who gave you that question? There is something in medicine called imposter syndrome. And it's this idea that, and yeah, everybody's susceptible to this. do I really know what I think that I know? Do I need to go look that up again? And the answer is sometimes, yeah. Do I know what I'm doing? And I think that imposter syndrome is actually something that is prevalent in every industry, but we talk about it a lot behind the scenes in medicine. Yeah, it's something that exists. How did COVID change my day-to-day? Oof. I have to wear a mask all the time. It dramatically shifted in how we can approach trying to help somebody, and both made it easier and more difficult. So I actually do more telemedicine through Zoom visits than I have ever done previously, which to me is actually really cool. We can do video visits and I get to help more people, and you can stay at home while we do it. So it's the tremendous effect on my day-to-day. These are some great questions. Thank you, everybody. I really appreciate the questions.
All right. If you have more questions, just put it on the chat. And if that is all, then we'll let Dr. Horner get back to work.
Yeah, right.
Okay. Okay.
Is there a minimum score on the MCAT to get into medical school? So that the MCAT is the medical college assessment testing, and that's the test that you have to take. And the scoring really helps dictate whether or not you go to medical school or not. Is there a minimum score? Now that changed after I had taken it, so I don't know what the number would be. There's generally not a minimum, but there is kind of a mark that you're trying to hit. And most medical schools will tell you what that mark is depending on the school. And what would you say are the most important skills to have to becoming a practitioner? Willingness to take time and listen, willingness to serve, willingness to say you don't know, that you'll look it up, willingness to go back and try and gain more information and relearn something you've learned a couple times before. That's probably, I think stick-to-itiveness, persistence. These are all other terms that you could use in that situation. It's a good question, Liberty.
All right. Thank you so much, Dr. Horner. That's a lot of good information. And
yeah. Well, it was certainly my pleasure. I really appreciate the questions and everybody else's time. And yeah, thank you.
All right. I'm going to go ahead and start closing out the meeting. Thank you again for doing this.
All right, everybody have a